Welcome to the Holistic Health Show, where the worlds of science and spirituality converge to illuminate a path towards total well-being. Join us as we embark on a journey to bridge the gap between Western medicine and complementary therapies, offering you a roadmap to embrace a proactive, holistic approach to your health. It's time to empower yourself with choices that nurture your body, mind, and soul. Welcome to a world of infinite possibilities for your optimal health. Welcome back to the show, everyone. Today we have Nancy Lieff on the show. Nancy is in Newfoundland, Canada, which is where I'm from. So it's really exciting to connect with somebody from home. Thank you, Nancy, for joining us on the show today. I think it's going to be a really exciting conversation. Nancy's business is Blackbird Holistic Therapy. Blackbird Holistic Counseling. And today she's going to talk to us about EMDR therapy. Nancy, I'd like to know what EMDR stands for to start with. I have heard of it before. I can't quite recall what that means. So go ahead and jump right in and educate me on all things EMDR.
Awesome. Yeah. Well, hi. It's good to be connecting with a fellow Newfoundlander abroad, and you're doing amazing work on your podcast. I've listened to
Thank you.
a few sessions, and yeah, it's really interesting, fascinating stuff. So EMDR. So it stands for eye movement desensitization reprocessing. So it's kind of a fancy name, and it's a big model, I'm not going to lie, but essentially what this model is about is it is a treatment. It's treatment for processing trauma. So it's been around since the late 80s. This lady by the name of Francine Shapiro invented it almost by happenstance. Sometimes that's how the best ideas are created, I guess, right? Like sort of mistakes in a way, or just sort of experimenting. Anyway, so she developed this in the late 80s while she was treating Vietnam War veterans in the United States for their trauma, obviously. And, it just became a thing that evolved over time. And, I've been in this field for 15 plus years. Sure, I haven't been doing this for a lifetime or anything, but I must say, like, I didn't really hear too much about EMDR until recently. I heard the treatment modalities name being thrown around over the years, but nothing really not a lot. And so I became, unbeknownst to me, part of the resurgence in popularity of EMDR, at least in my corner of the world. I'm getting a lot of, say, more government type of agencies reaching out to me because they're looking for more EMDR therapists because clients are asking for more
Wow,
EMDR
okay.
therapy. Yeah. So it's pretty cool. So it is enjoying a resurgence in popularity, which is great. I guess people are recognizing that, most mental health conditions, if you're going to ask anybody like me, the root of them, including addiction, which is a mental health concern, so I look at it, is trauma. And so EMDR postulates that when we experience a mental injury, AKA trauma, and it can be like big, traumatic events, one would think like a car accident, so on and so forth. They can be small t. So these are the things that a lot of people might not even realize were traumatic event during their life. When we go through traumatic incidents or traumatic periods of time in our life that were too big, too much, at that time to fully understand, which, when you think about kids, they don't have that developmental capacity to understand fully what is occurring, has occurred, and be able to let that leave them. You're looking at trauma and that memory, all of its components. So this is where it gets interesting because a memory is not just a picture in our mind. It's a somatic experience. It's an emotional experience.
And then that's something I was going to ask actually is anyone who might Well, I guess as I'm forming my question, I'm thinking of a couple more, and I want to be direct. So, I suppose when somebody comes and sees you, do they necessarily have to know what issue is causing them pain? Or do
No.
they just, yeah, so they could come to you and say, look, I'm experiencing this. There's something I want to work through, and I don't know what it is, but I
Yep.
feel like my life could be better.
Yes, I'd say, but
Okay.
like I read sometime in my life, I don't know when this was, but I read one time that 80% people who come to therapy don't know why they're there really. They can't identify. It's like sort of an ambiguous thing. They just don't feel well, or
Mm,
they feel like their life is falling apart. Some people come in though and they say, hey, look, I'm depressed, been diagnosed, got trauma in my background. I haven't been the same since this happened. I wouldn't say that, sure, it's nice to have that awareness, but not everybody's going to have that kind of awareness. And that's okay because the way EMDR works is it's like a big 8 phased process. And we just tap into, a person's current life experiences that may be difficult for them. And there are tools and techniques to help them connect to previous memories in their lives where they felt the same way, almost like a free association type of technique called float back. And that's how we draw the line between what's going on in their current day life and in their past experiences. Some of those experiences are memories that people totally forgot about or never
yeah.
would have even thought had anything to do with how they feel today. So, right. But that trauma is stored and locked in a person's body, in the brain and in the spinal cord.
And
And
this leads
EMDR
me,
gets it out.
and this leads me to the question because you hear some people say, oh, I tried therapy, but it made things worse because I had to think about things that I didn't want to think about. And so I felt worse. And how do you address that? Or how do you get someone to get past that? Because you don't, of course, want them to feel worse. But then certainly if you are working through trauma and, opening old wounds, you don't want them to leave open and vulnerable like that. So,
Yeah.
I mean,
Uh-huh.
what do you say to people who kind of have that view on therapy, on
I
any
wouldn't
kind of
blame
therapy, I
them.
suppose?
Yeah, I wouldn't blame them for having that type of wonder and like concern because like I was a talk therapist before all this,
Mm,
right? EMDR is not talk therapy. Sure,
yeah.
I like to set up my sessions where we have a little connection and we get into the menu, I call it, the
Mm,
EMDR work that we're supposed to be doing or could be doing that day to help them work on their trauma. So, but EMDR, the tools that you use in EMDR, quite literally, and this is sort of my take on it that I've sort of formulated over the past few years that I've been doing this. It's like you're putting on safety gear
yeah,
to
okay.
handle sensitive, toxic, you know, material. So not just for the client, it's quite literally putting on your PPE, your helmet, your fire gear to go into this. And it is for me too. And so you don't necessarily have to give me all the the graphic details of a traumatic incident. In fact, I always say to people, look, I'm here to listen to you. If you want to talk to me, sure, go for it. But I don't ever want my clients to feel like I don't want to listen to what they have to say because look, you have to
Yeah.
be a validating person when you're a therapist, of course. But I say to them, it is not necessary. What is necessary is that you give me brief descriptions and you we stick to that is you connecting to the traumatic experience in your body and me using my EMDR tools. And here I am doing this because this is one of them.
Mhm.
I'll tell you about that in a second. And that bilateral stimulation, which is this is one way of doing it, finger movements, and I get out of the way.
Mm,
They watch fingers move across the midline of their vision. So that engages both sides of their brain. Both hemispheres of their brain get to communicate about an experience that they haven't been able to fully process because it's stuck somewhere. And
Wow.
that mechanism allows them to process that experience. You literally see emotions move on through their being. Sometimes they're like, I don't even know what I'm feeling. It's
Mm.
okay. You move it on through. And that's just one example of like what helps a person not feel like they are bleeding, and not contained from their
Yeah.
trauma. And then, of course, by the time that we get to the part of the EMDR therapy where we are actually processing trauma, we have already had done a bunch of trauma resourcing techniques.
Mm.
That's the prep work. You'd never just jump in and start doing unpacking trauma. So when you do have a session where you're processing trauma and afterwards you're like, oh God, I'm spent. I'm thinking
Mm.
about that little bit. Okay, let's be in you now. Let's co-regulate. I'll do it with you. Cause of course I got my own resources
Mm.
installed in me,
Yeah.
and we regulate and I'm checking in about how they're feeling. And I always set up the last 10, 15 minutes of my session to make sure everybody is contained. And these resources, maybe we'll get into in this interview, I don't know, are like very, I should say, effective
Mm.
ways to contain the material so that it is stored away in a different place in your brain until you return a session and you have that control to take that back out. So
Yeah.
it's got practices set up to help contain the materials, what I'm saying. And also the mechanisms of using EMDR are protective in that sense that the material is held in a way that it is safer to process trauma.
Yeah. So again, I have multiple questions,
Yeah.
which is good. This is interesting. I guess I'll start with, you said it's an 8-phase process. Does this mean it's a phase per session and so someone comes 8 sessions, or how are the sessions lined up? What can one expect when booking a first session with you, I guess, as a long-term plan?
Yeah. So the way
And
it
I guess, is
goes,
there a short-term plan? Like
well, yeah, it sounds like it could be an extensive thing, but what I
Mm.
have found and this is in the literature with EMDR, is that what would take a person, and I'm just speaking in generalities here, because of course there's exceptions to this. What would take a person normally like years to process can take 6 months to a year.
Okay.
EMDR is like therapy on jet fuel.
Wow.
It's super precise. The methods are standardized. Like it is such clean and precise and powerful work. So when you come in though, like I said to you just previously, I'm never going to sit down with somebody and be like, tell me all your trauma
Yeah.
and like, let's start processing. Nope. So you spend, like, for me, it could take about, you know, 4 or 5 sessions, maybe even longer to get all of this resourcing set up. Now that's the prep work. So that's phases 1 and 2. So, of
Mm.
course, it's just like what you would experience if you're going to some other therapist. You gather information, you do your consent to participate form, all that goes on. You have a consultation, all that. You meet, you start to develop rapport, of course.
Mm.
And, you know, meanwhile, what I like to do and how I like to teach my resources is I prefer to have someone come in and be like, okay, so like, I've met you for like a couple of times. We've done the consult, we've done the first session. So, how was everything this week? They'll give me maybe something that may have been somewhat distressing. I'll say, okay, let's take that experience now and let's learn a resource to help you emotionally regulate. That's what the resources are, to help a person regulate themselves and manage their symptoms that they're experiencing. So let's learn that technique and apply it to what was distressing you this past week. And that's how the
Yep.
first few sessions go, right? They come in, I'm like, okay, so did you practice your technique? Yes or no? Okay. How did that go? Great. And then they may tell me some other thing that might be bothering them or whatever. And then we learn the next technique and apply it to regulating that experience. So they get the experience with me, not just learning how to do the technique. but
Mm.
this is how I regulate. This is what it looks like. I'm there to guide them. So that goes on, like I said, for the first, depends, 4 or 5 sessions. And then we get into the other phases of EMDR. But a person there's a readiness,
Yeah.
that has to be assessed. There's other assessments that have to go on. So dissociation has to be assessed and other things that might be pertinent to the other person's mental health. So that can include outside kinds of assessments like for depression, PTSD, or whatever. And then once all that prep and readiness is done, then like I said, we start the processing. And so what I find is that once we start identifying the traumatic memory that we start with, each memory can take a couple of sessions to process. And then you move on to the next memory, so on and so forth. I could take a few moments to explain like that, but there's is quite a big technique where the identifying process of like, basically you have memory networks and yeah, these channels, I should say, like, you have channels in your memory, right? And it's very difficult to sort of explain it this way without because it's a big conversation, but you would have, for example, if someone went through a trauma and they felt like they weren't good enough and they believe that at the helm of every trauma is a belief about oneself that you take away.
Yeah.
So, that isn't true. That's illogical. That doesn't even make sense why you would make that about you, but that's trauma. So perhaps say, for example, a child went through separation, divorce. They feel not good enough.
Mm.
Well, that's what I would call a channel in your memory network. And there's probably a bunch of other little memories that are connected to the very first time that that person ever felt like they weren't good enough. And the gorgeousness of this technique is that you don't have to remember all those memories
Yeah, and the reason I
because
was shaking my head just then is because as you're, kind of saying this, I'm thinking just right from birth, we're impacted by so much,
oh yeah, we are,
you
right?
know?
We have mental injuries, just like
Mm,
right from birth, we have physical
mm,
injuries.
mm,
We have mental injuries and they show up as trauma and they get triggered because they're not resolved and not treated. Just like if you had an injury in your body, if it wasn't treated, and it would
yeah,
show up through your lives. No different, right? Except for you
yeah,
can't see these. But EMDR helps you see it and develop a network and apply the same principles. So you start to knock them out,
yeah.
right? And you change those beliefs about yourself as a result.
And so, I mean, you mentioned anyone suffering PTSD or depression, and, I guess kind of all those, when people think mental illness, they think these kind of bigger issues that people might have. But I mean, would EMDR therapy also, someone who's lacking self-confidence or is a generally happy person, but is afraid to, I don't know, maybe experiencing some social anxiety or, not that it's overwhelmingly debilitating, but an awkwardness or
Mhm.
a fear of moving on to a new career or making new friends. And I'm not trying to minimize those feelings by
Yeah.
saying they're not as severe as depression by any means. I guess I'm just
Yes.
trying to gather information on the broadness of what EMDR can,
Could do for
why
people.
somebody would come and
Yes.
see you or anybody else for EMDR therapy.
Yeah, and that's a really good point because I was actually thinking about this earlier today when I was doing my work was that, another beautiful thing about EMDR is that it can recognize that, mental health concerns exist across a spectrum and you don't need to necessarily be going through like what's considered atypical or abnormal, which would put you in a diagnostic category.
Mm,
There's a whole lot of other mental
yeah,
suffering that can go on that's outside of diagnostic category. And it can, that's what the resourcing and learning those techniques to help a person manage the symptoms that they experience, like say anxious feelings or confidence.
Mm.
like self-esteem. That's what the first, I call it chapter, it's phases 1 and 2, can help people with. And it's interesting you said self-confidence, because I find that as when people are able to feel stress or anxiety or go through their symptoms and they learn these techniques and they apply these techniques to those moments, you start to like move through those difficult experiences.
Mm.
And you did that. Your brain and your body can do that. Sure, I taught you how to do it, but I can't make your brain and body do that. You're doing that, and that gives a person confidence and
Yeah.
empowerment. Like, I can control this dread that I wake up with in the morning. That's not
Yeah.
enough to put me in the category of I'm like depressed somewhere. No, I don't have all the other symptoms, but I just
Yeah.
experience imposter syndrome, maybe
Yeah.
whatever,
Mm.
right? Like, like, I don't know. We all go through that in this kind of career. So those techniques are there to help person emotionally regulate. And you don't have to have a mental health diagnosis to benefit from that. You may not
Mm.
want to move forward and do the rest of the phases of EMDR and unpack trauma. I think everybody can benefit from that, but
Yeah.
you could literally get a lot of benefit from phases 1 and 2, those resources, not the therapy, but the resources, the
Mm.
skills. Yeah. That's a great point. Great question. Yeah.
Mm. And so anyone who is going through, and wants to do all the phases, wants to complete all 8 phases of the process, is it, and I mean, this could be client dependent, but is
Yeah.
it a once a week thing? Do they come in once a month? Is it up to them? Or where are best results seen?
Hmm.
And I guess my follow-up to that is there homework? Are they going home and then
Hmm.
also doing things? Is it like physiotherapy? You go, you get your exercises, and then you have to go home and you have to do them,
Yeah.
and they know if you're not doing them, right? It's
I
obvious.
love this.
So
I love this. These are great questions. So, like, you never say you didn't know much about EMDR, because these questions are just like, yes, my brain is like, yes.
Mm.
So, like, one of the big things at EMDR, people who are experts in this field or do this, are they tout that there's no homework. They
Mm.
help a person establish a routine. Now, if someone else look at that like that's homework, so be it. But it is not your typical, I'm going to write this down for you on a card, take your homework and go home, practice it, write your letter to your ex partner, and we're going to do
Mm.
this. Certainly not, make fun of that kind of intervention, but it's
Mm.
not the same, because this is not talk therapy. We're here to condition your nervous system. I tell my clients, you're coming to the mental gym when you see me. We are going to work out in your mind, and you will get
Mm.
gains by regulating after you talk about this hard stuff. So you do the techniques with me in session, and then I encourage you, and I'm sure other EMDR therapists do this too, to start to set up a routine where you are practicing your techniques in the morning, in the nighttime, and whenever you're feeling stressed or triggered,
Yeah.
distressed, right? So that's essentially what, quote unquote, you could arguably say is homework, but it is not, homework. Now, when people come back to me session by session, which usually goes to answer your other part of your question, and is client dependent, you can come every week. I like to say every 2 weeks. Now, there are clients whom I have had to see every week due to the level of distress and the nature of what they're going through. And maybe they have the resources, they can do it. But the literature says that you can still feel the impact or the effectiveness of EMDR therapy if you come up as long as every 3 weeks. But after once every 3 weeks, it doesn't show itself to be as effective. So anything, within that time frame from 1 to 3 weeks. But yeah, but when people come in, of course, I do an assessment. So what is different? What has changed since the last time? Have you been practicing your regulation techniques? And they all know, because I tell them, okay, we're going to have the same questions every time you come in, just so you know. Okay, And they'll be like halfway through their last, till the next time they're like, oh God, I didn't do my, and I'm like, hey, look, this is not about A plus plus student. This is about integrating it into your life. And that's a process. So
So I
relax.
suppose instead of
Right?
homework, it's about building new habits,
Yeah.
would we say?
Yeah. You're shaping your lifestyle. You're learning how to shape your nervous system quite
Mm,
literally to help you stay resilient against those triggers that will come upon you because we can't stop the triggers from happening.
yeah.
But what ends up happening is our responses are completely different because that dysregulated nervous
Right.
system, that material is processed or being processed. So it's not dysregulating, right? As much. Yeah.
And then I'm curious now about what goes on in the sessions. You were moving your fingers back and forth, and I guess an individual is following that, and that's the eye movement. And correct me if I'm wrong, but what else is there?
Yeah. Great question. So like so I should back it up tiny pecks. So what I'm doing, I'm getting it out of the way because like essentially I'd be like this if I'm doing virtual, right? And
Mm,
so that's called the bilateral stimulation. And that is the mechanism by which the brain can process the traumatic material.
and I've
So,
seen sorry, just before you go on, I've seen, a lot come up recently about vagus nerve
mm,
stimulation, and that's moving
mm,
the eyes as far as what I've
mm.
seen anyway. Is it the same sort of idea, or is it stimulating the vagus nerve, or is it completely unrelated?
I think to be honest with you, I would have to look into it a little bit more, but
Yeah, okay.
I do like it would not surprise me if it was because the vagus nerve is connected to your central nervous system,
Yeah.
right? So bilateral stimulation through, you know, creating a pathway to engage both hemispheres of the brain, the right side and the left side, about a distressing event and helping that brain process that and understand it and therefore let it go and henceforth become regulated through your nervous system, right? Like that involves your vagus nerve,
Yeah,
right?
okay.
So, because your nervous system, of course, is everywhere. This bilateral stimulation stuff, you can do finger movements. That's the gold standard. Some people can't hold dual attention. What I mean by that is have a hard time following fingers and connecting to the material in their
Uh,
mind at the same time. That could be for so many reasons,
so does
right?
so does this mean that you're speaking to them while they're following?
No. This movement, like I said, some people can't maintain that dual attention for many reasons. It could be because they have processing issues outside of trauma. Maybe, they have, sensory processing issues. It could be that they dissociate. So that's a big one. When that happens, I say, don't fret. We will get the bilateral stimulation for you. Don't worry about it. There's lots of ways we can do this. So you can tap
Yeah.
because you're engaging both sides of your body and that creates that connection between the two hemispheres of the brain. You can also have a light bar to follow. I'm thinking about getting a light bar simply because my arm gets pretty tired after all.
Mm, yeah,
um,
certainly.
there are paddles and you hold them and they have like one in each hand and they have buzzers kind of and they
Okay.
vibrate in your hands. So that engages both sides of your brain. So there's lots of different techniques and essentially, yeah. So this is because when we're dysregulated, we're thinking about trauma or we're triggered. Our sympathetic nervous system, the branch off your central nervous system, which is the fight or flight part of your nervous system, is the part of your nervous system that says, alert, there's danger. That gets lit up. Your central nervous system and your brain, I speak to my clients about it this way, becomes literally like the Christmas tree that is lit up so bright you can't even look at it. It's uncomfortable. And you don't know where the light switch is. Oh my gosh, turn this off. So this and the resources themselves that I teach people, it is a hack
Mm.
into your parasympathetic sympathetic nervous system, which is the rest and digest part of your nervous system that controls all the involuntary movements in your body, breathing, digestion, heartbeat, so on and so forth. And it calms your nervous system because it's the right stimulation that your brain and body needs to be able to soothe.
Right.
It's incredible stuff.
Yeah, it sounds it.
There's a lot of neuroscience to it. It could go on about it, more and more. But that's the gist, right?
Yeah.
And so included in that is the vagus nerve.
You mentioned dissociation a couple of times and that you need
Mhm.
to kind of evaluate for that. So, can you explain to myself and anybody listening what is dissociation?
It's a very good question.
I'm
So
full of them.
I
I'll
love
keep you on
these
your
questions.
toes.
I love it. This is my favorite. Yeah. So, yeah, dissociation is a trauma response. And if you want to put it blunt and you want to have a real clear understanding what that is, dissociation is a trauma response. It's a defense mechanism because whatever you're experiencing in that moment, you know, is too much for your nervous system to
Mm.
process. It's either too much at that time or it's too much for too long,
So, is it
right?
somebody kind of shutting down and going within, or?
Mhm.
Yeah.
That's one way how it's expressed for sure. You see people, and like, I mean, the general population dissociates. I want to be clear. We all
Mm.
dissociate. There are some mental health conditions that you'd be surprised are involve dissociation more than some psychiatric mental health conditions. So people with
Okay.
PTSD dissociate more than people with schizophrenia, right?
Okay.
And people are, hey, how could that be? Well, it is because dissociation is a major piece of the traumatized brain. So
It's self protection, I suppose, is it?
it is
Yeah.
because you would not be able to withstand the intensity of
Yeah.
that difficult experience for that long. And of course,
Mm.
if you're if this trauma is happening as a child, you don't even have the mental faculties. You don't even have your brain is not done to even,
Mm.
I mean, you're really unable to process what's happening. So children often do dissociate because, when you're a kid, what kind of choices do you have? Like you often can't fight back.
Yeah.
You can't run away. So dissociation is what people do. And you've heard this said maybe when there's no other escape.
Yeah.
You go to a different place and that's protective. And this would not be a function of our human body and brain if it didn't help us get to this day, October 11th, 2023. It would not be here. It wouldn't be here. So it is protective. It is necessary. It's a survival technique. However, what happens is when we get traumatized, your body is going to keep thinking that that's happening. Like the threat didn't go away. And your mind is like, well, I know that I'm in a different scenario. Like it's 20 years later, da da da. Chill, body, brain. But your body's like, when it gets a trigger, it thinks it's happening. It's reliving the experience. So you have very asynchronistic experiences going on. And one of those experiences can be the dissociation. So I find that when people are initially triggered, lots of times they're okay for a little bit hanging out in that distress. But if we don't intervene with, therapy or in therapy and recognize when someone is dissociating, if you don't intervene and help them become more present in their body, identify what's going on, so on and so forth, or if they're outside of therapy and they're triggered and they don't notice, which is normal, very normal.
Yeah.
And what ends up happening is that over a period of time, you dissociate because you just can't hang out in that zone for too long, that distress, right? So we check out. We can be
Mm.
checked out for a long period of time, right? But yeah, like people withdraw, they check out in session. Sometimes I'll see eyes glazing over, like slowed speech, delayed responses, sort of like someone looking like they're pretty preoccupied or vacant,
Yeah.
so, but there's the fly, sorry, is that it's a normal part of working with trauma. And because some people get some reactions to the fact that they are associating. Maybe they're just realizing that they dissociate because they learned that
It was
in
going to be my
therapy.
next question. Do they realize that that's something that they do, or is it a state that you're unaware of?
For a lot of
Mm,
people, they don't realize that that's what they're
yeah.
doing. Yeah, well, and this is why I do this assessment that
Yeah.
assesses how much a person is dissociating every day, because
Mm,
that's protective to know that you dissociate, even though it's can be a shocking and scary
mm,
thing.
yeah.
But
Certainly.
it's better to know that than not to know.
Yeah. I suppose once you know, you can then begin working through it,
Absolutely.
which is a journey in itself. And
Hmm.
so, is this something once an individual completes, their phases of therapy, of EMDR therapy, are they then done? Is it over? Is it, you come back to kind of maintain, or is it, what's the scenario afterwards?
That's a really good question. And I find so like people will, work through their trauma. Some people want to maintain their mental health. So we might switch modalities because I don't just do EMDR. I do a lot of alternative healing as well. And
Mm,
I like to weave that in when it's suitable for the client. Some clients, I just do EMDR work. I love that. There's no preference. There's no judgment. I don't, that's not my agenda. It's what a person needs. So if
yeah.
they are a mind that thrives in the EMDR and I don't sense there's a spiritual dimension to their healing journey, I don't go there. When I
Mm,
got people who are clearly showing signs, they may know that they may not know. And of course, the work may take on a broader lens and I bring in spiritual uh, healing and expansion in that
because
level of
you're a
consciousness.
certified counselor, an EMDR therapist. You're a naturopath, I believe.
He is naturopathic counselor. And
Yeah.
so what got me that title was my work with as a shamanic practitioner.
Right.
Yeah. So that's where I do my spiritual work. So sometimes I'll focus on when the trauma is nice and, cooked. It's people are finding lots of relief. They're starting to make life changes that are changes that perhaps they've needed to make for many years, but just
Mm,
could not find themselves to make those changes because trauma was blocking their natural strengths and abilities to create change and evolve in their life. That's what trauma does, pain does. That's all blasted out. You're able to do these things. Oh my goodness, they start to open up. I find a lot of people start to open up spiritually. So, hey, did you know I'm also a shamanic practitioner? I can help you with that, right? And some people don't realize that till then, even though I do like to introduce it, the fact that I do that work. And if they're up for that, wonderful. If they're not, fine. Maybe they have their own spiritual systems. Wonderful. If you need my assistance, I'll help you with that. So we do work in that domain, right? So, but yeah, so guess it depends on the client and what they're looking for, what their goals are, and if my services can fit that need, basically. Because some people just feel better and they say, "Thank you,"
yeah.
and they go on, and I'm
Mm,
very proud of that.
yeah, of
Right.
course. So, how do clients say that the EMDR has improved their lives? What have you found that, I presume that they're coming back and saying to you, this has changed and this is what the results I've seen. So, what are some of those?
So some of the clients, like right away, I mean, people feel immediate alleviation of symptoms
Mm,
lots of times in the first session because they learn technique in the first session. So I
right.
hear, wow, I haven't felt that relaxed. I don't know how long. Like,
Okay.
Nancy, how can I be talking about difficult stuff and now be like feeling amazing?
Mm,
Right. So, I'm like, well, you can do that. This is what you can do. Right.
yeah.
So I see it in the first session. Of course, I see it in the first chapter, like phases 1 and 2, is where they're doing all the prep work and they're getting used to regulating their system and conditions. Then when we start to do the trauma processing work, I hear people, yeah, making changes, like becoming aware of being triggered, stepping in with their resources, and that enables them to respond differently to a trigger.
So would that
So
be, a decrease, say, in either going into this dissociative state or an emotional outburst?
mhm,
Are those the sorts of
mood
differences that they're
changes.
Hmm.
Yeah. So your mood becomes more stable. That's one of the questions I ask in the assessment phase of every beginning of every session, asking about mood. So mood stabilizes. Unhealthy coping mechanisms decrease. You don't
Hmm.
need them,
Yeah.
they find, because they're more regulated. Improvements in their relationships. Sometimes, though, unexpectedly, there may be unequilibrium or disequilibrium in
Mm.
their relationships because they're saying no where they normally wouldn't,
Yeah.
because they're standing up for themselves. They've got more self esteem, maybe more confidence, saying no. So sometimes those changes are, well, I'm leaving my partner, but now not
Mhm.
always.
Which isn't
But
necessarily negative as people grow.
mm-mm,
Mhm.
no, it's not, right? Maybe some people, part of their issue is that they're stuck in a relationship that is not healthy for them.
Yeah.
So, but that's some of the stuff. And then I see people having courage to maybe go back to school. I see that a lot. I
Well,
see people with chronic pain um, tell me that they have less pain,
well,
that gives them better functioning, more patience for their children. I hear that a lot. More patience for their children. And then I hear stuff like, I can sleep better. I hear that a lot. And I've got clients on my caseload that I've had in my caseload before I ever did EMDR therapy. And they're the ones that I'm very interested in as well, hearing what they have to say because they know what the difference is.
mm,
Like, from their lived experience in sessions from having talk therapy and then this
yeah,
EMDR therapy. And they're like, Nancy, I don't know what this stuff is, but I don't know how
mhm,
it works. It's a mystery to me. It's crazy stuff, but it's weird, but it works.
yeah,
I'm like, hey, and it's a wonderful thing to have confidence as a
yeah.
therapist to just know, like, when you do this, this will help you.
These are the results, yeah.
Gosh, it's so good because,
It
this
must be
field
very
is,
rewarding.
it is. You're like, you're
Mhm.
dancing in the gray all the time
Yeah,
here,
yeah,
right? But I mean, yes, it takes the practice that you need to do on your own with your regulation techniques. It can be difficult to come to session and be like, today I'm going to feel that stuff. You
mm.
know, it
Do you
takes
find
commitment.
people are bringing their children for sessions, or do you not work
Yeah.
with children? Yeah,
Well, I work with kids. I work with, well, not kids. I work with youth as young as 11.
okay.
But yes, certainly I do work with
What a great
children
resource to
11.
have going through your teen years.
Huh. Imagine like
Mm,
regulation
my
around
gosh,
such,
I'm just thinking back to high school.
well, my
If every one
goodness.
of the kids in my high school, including myself, had access to this, I tell you what, it'd be a different environment.
Wouldn't it? Just
Yeah.
think about it, right? And well, when
Mm.
I was in high school, there was no Google.
Yeah.
Like
Yeah.
it's a different situation right now with social media. I mean, my goodness, and the effects that has had
Yeah.
on developing brains and all that. So yeah, it would be. It's
Yeah,
it's
huge.
really good for that population.
Yeah.
Mhm.
And then I don't want to keep you too much longer. I know you're getting late there, but I do want to ask, is this something that you can do online? If it's this
Yes,
visual, yeah.
yes. So you know, I say client preference. If you are a person that wants to come in person, meet once or twice, try out the in person sessions, and then bridge your way into virtual, so be it. That's great. I do live in rural ish Newfoundland.
Mhm.
And so getting to my office, I have limited hours. Like,
I'm sure there are some listeners who's thinking, what part of Newfoundland is not rural?
yeah, exactly right. But
Yeah.
yeah, there is a part that is kind of not rural,
Mhm.
a couple parts. But
Yeah.
anyhow, so, that could be a barrier. But I do have people drive to quite a distance to come. And it's sure, I love in-person therapy, but when it comes to the effectiveness of EMDR, there is no difference.
Yeah,
Like as
right.
long as you can have a suitable space to
Mm.
do your therapy. I have people, of course, who don't feel safe at home.
Yeah,
Uh,
certainly.
They they're like, okay, I'll do a session with you virtually. I'm like, great. And then I
Where?
tune in and they're in
Mm.
their car. I'm like, oh my goodness.
Yeah.
And I'm
Yeah.
like, maybe you should come in next time, right? If you
Mm.
really need a space that bad. So as long as you got that space and you can keep a distraction free, because we all know how it can be when you're doing
Mm.
virtual work. Notifications pinging everywhere.
Yeah.
Close out your Facebooks and all that kind of stuff. To be honest, and when we're doing mobile, like I try to maximize the width of the
Mm.
screen. So I get people to turn their screen sideways, and that gives them longer,
Yeah.
if you can get
Yeah.
more of the BLS there, it's great. And people could be comfortable. If it's bad
Yeah.
weather in Newfoundland, that
Mm.
happens. Just
Yeah.
at the drop of a hat, say, I don't have transportation. I don't have childcare.
Mm.
It's stormy out. I've got your time booked. It does matter how I see you, of course, but
Mm.
your time is booked. Whether you're in person with me or virtual, I'm working with you.
Yeah. Perfect. Well, thank you very much. I learned a lot today.
Oh, I'm so
It's an-
glad. I have a healthy obsession with EMDR. So I could talk about it all the live long day. I love
Yeah,
it.
no, it's been very informative. And I would wonder if we had listeners who had questions, could we say have them post in the comments their questions and I feed them back to you? Is that something we can do?
Absolutely. That's a great
Yep.
way to do it for me. Yeah.
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 Mhm.
And then if anyone was interested in a session or learning more, I mean, do you have resources on your website for people to kind of have a look at that I could link? Or how could we get some more information in front of them?
Okay. Because my website is still being worked on. It's being
Yeah.
developed. So it's not really, um, I would say, ready for that yet.
Yeah.
But I do have some resources that I don't know if they could email me if they would like, and I could send them those resources, or we could do it where I send you those resources. You can
Yeah.
post it.
Yeah, why don't we do that? So, anyone listening, what we'll do, if you have questions for Nancy or for me, just comment on the video or on the audio, depending on how you're listening, and I'll feed those across to Nancy. And I'll get all the resources from Nancy and I'll provide those in the descriptions of the videos so you have access to them and there's not too much legwork for anyone involved in that one.
Yeah, yeah, that's great.
Yeah.
Yep. Cool.
Awesome. Well, Nancy, thank you very much for your time. I'd love to continue this conversation sometime. I've taken some
Me
notes. I have
too.
some things to reflect on. So I really appreciate it. And I hope you have a lovely night.
Oh, thank you so much, and what a pleasure. Like again, I get fired up about this, and I love to tell people about this, and I wish everybody very well, and I hope you have a good rest of your day, morning, evening, wherever you are in the world.
Absolutely.
And yeah, so I hope you learned something, and
I
thanks for
did. I'm
listening.
sure everyone will. Thank you so much for listening, everyone. If you enjoyed the episode today, I would appreciate it if you'd hit like and subscribe. And again, all the resources in the description. And feel free to look Nancy up. Again, it's Blackbird Holistic Counseling. And I'm sure she'd love to hear from you. Thanks, everyone. Until next time. Thanks for joining me on the Holistic Health Show. If you enjoyed the episode, subscribe now and get ready to embark on an incredible journey toward holistic wellness. Until next time, be well and stay holistic.